And our conversation with Doctors Ralph May and George Garrow, brought to you by Marcus and Mack, a law firm representing injured people. Let's get them up here. Gentlemen, good morning to both of you.
Morning, Todd.
Good morning, Todd.
Good morning. It's both good to have you both with us here today. Ralph, set the stage for us. The Guidance Center and the Primary Health Network with which Dr. Garrow is affiliated, you've come up with a really, really good loan program. You've got a grant.
Yeah, we got a very nice grant. Our partnership between Primary Health Network, which is Federally Qualified Health Center, and Dr. Garrow will talk about that in a little bit, and the Guidance Center is really designed to reach individuals who are reluctant to seek mental health services, come to the clinic. They are seen in primary care. The vast majority of mental health services taught in the country is provided in primary care physicians, prescribers, with meds and such, because people are afraid to seek mental health treatment. And so we got PHN and us got together and we got a federal grant, a SAMHSA grant, a substantial one for 5 years to be able to partner to create an opportunity for mental health practice to be in the primary health office in Jacksonville. So we have therapists there, we have caseworkers there, so that we can make accessibility to mental health services much greater. So the person goes to their primary health office, they can get their therapist, they can get their work right there instead of having to go to the clinic.
Mm-hmm. Dr. Garrow, the Integrated Care Program working out of the Jacksonville office of Primary Health Network. Tell me how it works from your standpoint.
Yeah, Todd, thank you. It's actually really a great opportunity for folks to receive the right care at the right place at the right time. One of the advantages of establishing or having patients established with a primary care provider is trust, a relationship to sort of manage health conditions over the long term. And in partnership with the Community Guidance Center, we're able to evaluate patients who may benefit from behavioral health services, mental health services, and we actually can give a warm handoff. Right in the same hallway, right in the same building. We just walk the patient down to the guidance center personnel, and the patient continues to have that trust, that confidence, and that relationship going forward.
And as we've talked with Dr. May quite often in the past about this, mental health is generally not something that gets better when it's untreated, and the sooner you get treatment in situations where mental health is a primary concern, the better the outcome is likely to be.
Absolutely, and unfortunately, folks have the impression that having a mental health condition, a mental health diagnosis, comes with stigma. And through Dr. May's work, and certainly through the work with Primary Health Network, we're really wanting to erase that stigma and just recognize that a behavioral health, mental health condition or diagnosis it's a diagnosis, it's a condition, and it's nothing to be ashamed of, it's nothing to be embarrassed about, and really want folks to be able to get the right care that they need so that they can get better.
Dr. May, of course, we've talked about this in the past. In a rural setting such as we find ourselves, and people might not look at Indiana County as being rural, but really it is a rural situation. It's especially important to not let mental health slide because the resources are harder to come by in our areas.
Well, that's right, Todd, and I think that's what makes this partnership so great, is that by making mental health services accessible, I mean, Dr. Garrow was talking about trust. If you go and you have a doctor and the doctor says, look, the therapist is right here, let's talk to the therapist, because this depression, this anxiety you're experiencing is really, really an important medical condition that we need to treat. It carries a great level of influence to get people engaged. And it also, the transportation issue in Indiana County, we've talked about this before, is that people need access to care close to where they are, because sometimes getting from here to there, you don't have a reliable car, the public transportation is limited. So you're promoting better access to care. And the last thing for me, of course, how important suicide prevention is to me, Todd,
Mm-hmm.
but we know in Indiana County that the suicide rate among males is 8 times higher than females. And a lot of, in working with Coroner Overman, we find that a lot of the males have never sought any kind of mental health treatment. They won't go to a mental health center, but they'll go to a primary care physician And that primary care physician may be the last line of defense that detects their depression, that helps them get the treatment they need. And having that treatment available to them right there, I think, can be life-saving.
This loan or grant coming at the time that it does is really important as well. We just had the announcement that I saw yesterday for the first time that this year's walk for mental health, the Suicide Prevention Task Force, is not going to be happening. And so to get the word out to folks is extremely important right now.
Well, we're going to do that walk virtually, Todd, and I'll give you more information on that later. But the committee, the Suicide Task Force, is not going to let that go. We're going to do a virtual walk. We're going to get information out to the community. We're not going to let awareness be stymied by COVID. I mean, this can't stop. The mission must continue.
Dr. Garrow, when you have folks come in to visit you at the clinic in Jacksonville, the office of the Primary Health Network, tell me about identifying mental health as one of the real concerns that someone might have. They might think it's just a physical condition. Talk about that whole process, if you would.
Sure. So we actually do screening. We have screening questionnaires that are we ask folks questions about their level of stress and how are they managing, and if they trigger as part of that screening that they might be suffering from anxiety or depression, et cetera, then the physician, the provider, uses that as an opportunity to have a discussion with them about, let's talk about, how you answered these questions and, what can we do to try to help you. Medication is certainly something that a primary care provider can, prescribe. It doesn't necessarily mean a referral to a psychiatrist. But medication management is really only part of the solution. Having access to therapy, to work through the conditions that may have been positive on the screen is also a critical component. And having this as an integrated partnership allows us to really treat the whole patient, a very holistic approach to their care.
Dr. May, we have talked, you and I, about COVID-19 and the various anxieties that come with it. With the protest culture that has sprung up here in the last 3-4 weeks, again, anxieties are really running high right now, and people in your profession are seeing the results of that anxiety.
We're seeing generalized anxiety in the population is going up. I mean, there's so much going on. We're taking two hits with the social awareness, the protests, but also COVID. We're getting a double whammy at the same time. So people are really in a state of heightened anxiety, worry, concern, uncertainty. So that raises the whole temperature of the population. So we're certainly seeing, in the clinic, the demand going up. And certainly I think that means the need for our partnership in the primary health network is really critical, because there are a lot of people that will only talk to their prescriber, only talk to their physician about that. They won't think it's bad enough or think it's important enough to seek a counseling or support. And so we really want to reinforce the availability of services for people right at their level so that they just don't ignore it and brush it off when they need to talk to someone about it.
What are the mechanics of operating in telepsychiatry mode?
We have access to telepsychiatry at that site and at the Guidance Center site. So if Dr. Henry Waba, who's the physician there, feels, talking to the psychiatrist is really important, we can get tele for them to operate. We can get them up to the Guidance Center for them to be seen if they want to be seen up at the Guidance Center. It's very, very important. And I think what's happened here, and we haven't touched on it, but the communication between the doctors is really important. Mm-hmm. Dr. Waba and Dr. Haber, our psychiatrists, communicate very well, with permission and consent, of course, of the patient. But you can coordinate care much better when you're in a partnership like this. So it's not like you have to wait and try to find someone and send a letter. The communication about care is much better. And that makes care of a much higher quality, because if meds need to be adjusted, if something's going on, the doctors are talking about your care more readily, and I think that makes a big difference in the quality of what we can do.
Absolutely. Dr. Garrow, of course, you know that the different strengths of the different medical professions that we're talking about here, psychiatry and primary care, they can work together in a nice relationship as well.
Absolutely. I am my entire career, I believe that we do better when we work together and not working in silos. And so having a communication between your primary care physician and the psychiatrist is equally as important as having, good communication between your primary care physician and your cardiologist if you have a heart condition, or your endocrinologist if you see an endocrinologist for diabetes. It's really important that we all need to be on the same page and work together for the betterment of the patient, and really putting the patient at the center of everything that we do.
It is $2.5 million over 5 years. Dr. May, how does that $2.5 million best be utilized?
Well, what we're doing is, it really, in America, the mental health system and the physical health system haven't been really well integrated historically. And so a lot of the money has to be spent on building bridges, communication bridges between the primary care system and the mental health system, staff getting to know one another, co-locating, getting the equipment we need to be able to operate in a unified fashion and exchange information effectively. It's stretched over 5 years because it takes time to, as Dr. Garrow pointed out, silos. It takes time to break down those silos. And the providers on the front line don't have any problem with it. It's the systems aren't used to really working well together, and it takes time to get that working.
Absolutely. All right. Well, gentlemen, we thank you for joining us, Dr. Ralph May, Dr. George Garrow. Dr. May, we're going to have to get on another time here and pretty soon to talk about the Walk for a Wonderful Life, okay?
Absolutely, Todd.
All right. Gentlemen, thanks so much. Have a great day.
Take care, Todd. Thank you.
Thank you, Todd.
All right. We'll see you. It is the voice of Indiana County, WCCS, AM 1160 and 101